Hello, esteemed viewers. Good day and welcome to Medicine Focus. As always, Medicine Focus is a channel that brings the different classes of medications that are being used in the management of different disease conditions to our understanding. Once again, Medicine Focus looks into the medications that are being used in the management of a particular prostate condition, also known as benign prostate hyperplasia or benign prostatic hyperplasia. But before we look into the medications, as always, it is very good, it's very essential that we get to know the disease condition itself in brief. So, without much waste of our time, let's quickly look into BPH in summary. Benign prostatic hyperplasia is the most common benign tumor in men and becomes more common with age, and is responsible for urinary symptoms in majority of males over the age of 50 years. BPH simply that meaning enlarged prostate, and that prostate, the prostate gland, its main function there is to produce semen. That's its main function. But the problem there, the prostate becomes enlarged. The cells inside the prostate proliferate, thereby constricting the urethra and resulting in urinary outflow obstruction. And this disease condition, it is mostly common in men over the age of 50. As you age older, you become more prone to these disease conditions. And this disease condition can lead to some bothersome lower urinary tract symptoms that can impact negatively on the quality of life. But it is very important to know that lower urinary tract symptoms can be caused, or lower urinary tract symptoms etiology is due to different factors, can be due to different factors such as bladder cancer, UTIs itself, urinary tract infections itself, urethral stricture. So, if you have these lower urinary tract symptoms, doesn't necessarily mean that you have BPH. But if you have BPH, surely you will have these lower urinary tract symptoms, because BPH, benign prostate hyperplasia, only etiology is enlarged prostate. So the pathophysiology. And why pathophysiology? Because by you knowing the pathophysiology, definitely you will know the aim of this treatment. You will know these medications, what are they aiming at. So the pathophysiology of BPH now. The prostate is a fibromuscular structure about the size of a walnut that surrounds the first part of the male urethra at the base of the bladder. Like I said earlier, its main function is to produce semen or contribute or form fluid component of the semen. So the prostate can be divided into a lobular inner zone encapsulated by an external layer. The inner zone is where benign hypertrophic changes are generally found, whereas most malignant changes originate in the peripheral zone. Prostatic hypertrophy or hyperplasia is directly related to the aging, you can see, like I said earlier, and hormone activity. Within the prostate, testosterone is converted by 5-alpha reductase to dihydrotestosterone, and dihydrotestosterone is 5 times more potent than testosterone itself, and that dihydrotestosterone is responsible for stimulating growth factors that influence cell division, leading to prostatic hyperplasia or hypertrophy and enlargement. As the prostate enlarges, it can compress the urethra, and this together with increased adrenergic tone can lead to bladder outflow obstruction and lower urinary tract symptoms. So we now know the problem there. So we now know how this prostate becomes enlarged. As you can see in the diagram there being presented on your screen, this prostate, the cells inside, as they proliferate, as they increases, meaning from the early stages to the moderate, you can see that diagrammatic presentation there. The more the cells there are increasing inside, the more it is increasing, the more it is constricting the urethra, therefore causing urinary outflow obstruction or bladder outflow obstruction. So how would now know this? Let's quickly look into the medications. And these medications are of only two classes. Medications of this condition, we have the alpha and the receptor blocking agents or drugs. In the prostate, alpha 1 receptors predominate and mediate the contraction of glands smooth muscles. You can see there are three subtypes of this receptor, meaning the alpha 1A, the alpha 1B, and alpha 1C. But alpha 1A is thought to be the dominant receptor in the prostate. And therefore, what this medication does is that it causes relaxation of smooth muscle in the prostate that becomes contracted by blocking the urethra and that of the bladder neck, which causes urethral lumen to widen. So, and by widening it, it improves urinary outflow. Examples of agents under this class are prazosin, terazosin, doxazosin, tamsulosin, alfuzosin, and doramine. This particular agent, tamsulosin, even the name, to me, it sounds nice, tamsulosin. So, some possible side effects include postural hypotension, dizziness, fatigue, headache, erectile dysfunction. And by erectile dysfunction being one of the prominent side effects, hence, treatment should aim to improve sexual function in men with this BPH. Another class is the 5-alpha reductase inhibitors or inhibitors. The primary androgen responsible for the development and progression of BPH is dihydrotestosterone, as we all know. There are two isoenzymes of 5-alpha reductase, the type 1 and the type 2. Type 1 is found in most 5-alpha reductase producing tissues, such as the liver, skin, and hair. And for the type 2, is predominant in genital tissues, including the prostate. 5-alpha reductase inhibitors downgrade prostate growth by blocking the conversion of testosterone to dihydrotestosterone. Hence, the agents under this particular class have been shown to reduce prostate volume, to improve symptom scores, flow rates, reduce the incidence of complications such as acute urinary retention and the need for surgical intervention. Examples of agents under this are the finasteride, dutasteride. So, this disease condition, non-pharmacological intervention, or having living it like that continuously can lead to complications such as renal impairment, persistent hematuria, bladder stones, recurrent urinary tract infections. We also have the surgical procedures. But as for me, as far as medicine focus is concerned, we only focus on medication. So that's it on this BPH. Hope you enjoyed the video. If you enjoy it, make sure you like and drop a comment, and don't forget to subscribe to Medicine Focus for more contents like this. Good day.